and welcome to another installment in the Formfast Educational Webinar Series. I'm Aaron, Director of Marketing here at Formfast. Thank you for taking the time to join us. In our last session, we heard from Kyle Hansen, Director of IT at Broadlines Medical Center, about how the hospital is working on achieving Stage 7 of the EMR adoption model. He discussed some of the challenges they faced and the benefits they've received from becoming more automated. Of that webinar is now available to view on our website at formfast.com/webcasts. Continuing our theme of improved automation in the hospital. As those of you who are familiar with Formfast know, we provide a number of automation solutions designed specifically for healthcare organizations, including electronic forms management, print and out management, business intelligence tools, and electronic signature solutions. There's a growing need for automation to help hospitals do more with less. Specifically today, we'll talk about the need for hospitals to better use data to pinpoint where issues lie so they can get ahead of problems concerning patient safety and revenue loss. So you can implement new processes to produce better outcomes. But to get into today's presentation, I'd like to review how to use the WebEx interface. Just note that the audio for today's event will be broadcast through your computer speakers. If you're having problems hearing the audio, please contact me via the chat window so you can join the teleconference. Once you've joined the teleconference, make sure your computer speakers are muted, otherwise you might hear an echo. So the Q&A and the chat windows are on the right side of the screen. Please send questions at any time. The presentation we'll go and save those to the Q&A portion of our presentation at the end. For those of you who are new to Formfast, we want to take just a brief moment to explain a little bit about who we are. As mentioned, we provide automation solutions for healthcare, including electronic form management or eForms, workstation, business intelligence tools or process improvement tools, document storage, and output management or print management solutions. Over 900 hospital clients internationally. We are the preferred or former partner with industry leaders such as Meditech or McKesson, and we're number one in electronic forms management in healthcare. Plus, we have 20 years of industry experience. Now, without further ado, I'd like to introduce our speaker for today, Sean Curtis. Sean is our Director of Product Management here at Formfast, and he's a regular contributor to our educational webinar series. As Director of Product Management, he often communicates directly with customers and industry leaders to identify challenges they're facing, and then works with the rest of the team here at Formfast to develop solutions to those problems. Today, here's some of the information he's gathered as well as insights into improvements. Welcome, Sean.
So go over just a real brief introduction to Formfast technology, and then we'll talk about how that leads to process improvements and the better processes, better outcomes that help today's event. So, attended any of our presentation sessions, you'll recognize some of these first couple slides, but really the message and the differentiator of Formfast. An entire solution for organization, regardless of where they're at in their maturity model. So this is, a three-stage maturity model that we've developed to kind of communicate where organizations are at along this pathway. Starting at the bottom, we have organizations and hospitals that are really on manual processes. They're pushing paper around, and people are really out and processing those through mail. Maybe in clinic areas they're getting printed forms and they're putting labels on those or stamping them with an embosser. Those still exist. So that's the stage one, and we offer the tools around that to help move stage one and stage two, or even within stage one, but even be more efficient rather than stamping, embossing, or label papers, automatically generating the forms not from an inventory, not from a stock, but from plain paper with patient demographics on it, so that it's accurate it's ready to go into the EMR if it ever wanted it out. It can be scanned in easily. And we'll talk about these solutions in a little more detail in a bit. Going to a more process improved environment with less paper. So eliminating some of the paper that you print, consolidating documents into single forms, using electronic signatures rather than printing consent forms and printing signature forms, and moving into a way of automating some of your processes that are reliant upon those paper forms. And this state-free is really paper-free, or else we're going to get paper-free. And that involves paper forms, electronic, which we did in stage 2, but then leveraging that electronic asset to collect information, move through your organization electronically rather than in a mail cart, and then capture that data as data elements. And that's what we're going to be talking about today, is leveraging the information that is floating around your organization in these forms. They're in paper forms, it's trapped in that paper form. Somebody has to key that in a spreadsheet or find another way to get that data accessible to you. So we're going to talk about how in stage 3 you're going to be able to leverage all the data that you're collecting in the system. Some fabulous things that are going to be able to show you what's going on in your organization. So how to do this? We have, a set of products, a product suite that points at each of these areas and just combines together to give ability to do all of these things. So, all of centering around workflow. Workflow is a loaded term because we have products that have workflow built into it. It's product like our output management has workflow built into it, to where we take rules and we decide where things are output and what format they're output in. Is it output to an electronic document? Is it output to a printer? Is it output to a fax or email? Management has a type of workflow in it as well. Forms of demand also has workflow, but we have a product that is on people workflow. So people do their work, and in that paper form, doing it on an electronic form and workflowing that form organization, like electronic signatures, to eliminate the printing of paper so you can capture the signature electronically. Forms so that you can get those forms when you want them, with the customization and personalization that you need. And where does all this content go once it's been created? So we have repository content management capabilities as well. So starting on our theme with the better processes, workflow automation. So when we talk about workflow automation in our product suite, we're going to be talking about taking it form or paper and putting those into electronic forms that are then used to collect data and information. We have the ability to take your forms, turn them into electronic forms, publish to an intranet type site, control the verbs that are available to your organization, control the distribution of those. Behind the scenes, the routing of that. So your users will be able to launch workflow in the form the way they're used to filling it out, because it looks like the paper form. It can out, and then they can submit the form, and the application understands, based on the users involved and the predefined routing and the data that's collected on the form, the application determines where to route that to. And it instantly, as soon as one person is done with that form, it instantly appears in the next person's inbox. Gives you a lot of controls over your process, making sure that things happen in a set order. It also eliminates some of the human error and eliminates the need for, really for people to understand more than they are focused on. So if somebody just has to fill out the form that they always had to fill out, and they don't have to worry about where does it go next, they're going to save time and not have to worry about getting that addressed to the right person or sent to the right person or making sure it got there. That doesn't happen. You basically fill out the form and it's where it's supposed to go. And it's going to go that way. It's always going to find its route appropriately. And there's really, limiting the amount of workarounds that your organization has too. So skips in processes can be a problem. Is accountability. When you're in our electronic process, once you document into that process, it's being tracked. Every step of the way it's being tracked. Every data that's entered onto that form, it's tracked who entered it and when it was entered. So the accountability, so you can find out where things are at in their process, how far along they are, and we'll show you some dashboards that help with that too. But it gives you the deep level analytic data that you need. So you get two types of data with this. You get data that's collected on the form about an order, a request, an approval. You get that information that was typed into the form, but you also get the information about the process of who's involved, what to do, how long did it take, those so that you can start improving things. A visual of what we do in our work process. I'll give you this sample. I always use purchase requisition because it's a pretty simple. I understand. You have a form, you want to purchase something, you have to have it approved by a certain number of people. In this, we're showing that if it's over $10,000, there's a specific sign-out that has to happen. It has to be approved by a vice president. If it's $1,000, it's approved and purchasing. So those rules were built right onto the form. Your pay form shows the rule. So all of these things are really intuitive. As building routes, and our tool makes it easy for you to embed these rules and these routes to the system. So you can take a look at forms and understand what the routing will be to implement this in an organization. I talked about all the information on the form. So back on this page here, we can see a few. These would be fillable fields here, the approvals. This, of course, has a lot more fillable fields. What happens is you're then able to start building your analytics to understand even better. So a report that shows the purchase requests that have been approved, and you may narrow that down to an organization or a business unit, and then also put those onto a scheduled task so that runs regularly and it lets other people know what's going on in that process. Type of workflow product improvement that we offer. The ability to take a single form, publish quickly, build rules behind it, and then deploy it and start reporting and start seeing information that's coming through the system. So this is eliminating spreadsheets that people would keep on purchase requests that came through manually. It also gives users the ability to track the process of the requests that they've made. But the level beyond that is to group this into a larger perspective that says, I have one form, I have a process that I need to control. So this is beyond just being a user who wants to make a request. This is a process owner, somebody who's responsible for all of the orders, or maybe all of your insurance and RAC audits to be processed on a timely basis. And you need oversight into that process. You need to see the global view of the process. And this is where we develop applications and dashboards to give you that global view happening within even a range of different related processes. It allows you to have a dashboard to see what's going on right now. It allows you to have a single place to go, and it's going to just show you things related to the communications and the collaboration events just related to that particular process. It gives you 5 of those process documents, and it gives reports to analyze, like I said, the process flow and the data points that are collected through that process. So examples of how an action is built. So I did mention, we do the RAC audit. That's a very specific around a process that has to flow in a certain timeline. if you're familiar with that, that's one of our Word applications that we have. Here's another one that was interesting. It was brought to us by a customer. We're working through this with them now. This is a record review where basically the quality department has a form with 60 questions on it. It's a paper form now, and there are about versions of it for different areas of the organization. This is sent out to different units, and each unit is responsible for completing 5 of those forms. So they go to a medical record, pull it physically, and fill out this form with a pen, and times. So we updated that. We took that form, and we took that form, rebuilt it to an electronic form so that it's easier to work with. It has drop-down lists. It obviously fills in user information from the database. It pulls in patient information from a database. So that's filled, and all they have to do is answer the questions, and then they have it writing to a database. It does calculations so that you get a percentage compliance rate, and it's very sophisticated. The form in the next slides. This gives them the ability to collect that information in real time, because it's in 2-week periods, and so they're going to want to see quickly what's going on, and they're going to track over time their numbers. They're going to distill this into different sections to see where their problems are, see if their improvement efforts are working. This is the form, and you can see, if you're familiar with Formfast and our forms and our tools, you can see that they've got required fields on here. These are the ones in red. That indicates that those are required to build out. So all these are going to be required. So they're utilizing that little feature there. So down here you can see this part that's their compliance number. So as the users go through and answer questions, yes, no, not applicable, as they're filling that out, that compliance number is tallying this up behind the scenes, and it's applying some weighted numbers and percentages to these different areas, and it's a compliance number. It also routing that you can see. So there's signatures, whoever entered the data, and the director has to review it. So aware of what's happening. That's why the signatures are required. That you can partially fill out this form and back to it over time, and then once you sign it, it's sent. So sign it over to the director. The director then reviews it, so they're aware of these issues. They can never say that I wasn't aware of it because they're signing off on each of these. So this is the process dashboard. So this user sees of the ending forms. So some of these forms have been started, let's say today, or the shot. So it tells us that these are just started, they're in process, they're audit, that's the subject line. The person that is filled out is Sean Curtis, Carla Walter, Serena People, and Joe Miller. The rate is shown on those forms as well. So that's just a configuration in the form to show this subject line. So I can have a quick dashboard that just shows me these are working on this form, it's coming to me, it's not here yet. Now this day's old, you'll see some other dashboards I have. If these get on 7 or 10 or 15, they're going to highlight, they're going to show me an alert message. Basically, they're going to alert me that there are any forms that are sitting there that haven't been completed. So I can tap to that. Who's filling it out right now? It shows that in the process, step 1 of 3, step 2 of 3. The most recent activity was. So that's one example of dashboard of what's in process right now. Forms are completed, that data is pushed into a database. That gives us the ability to start what's going on. I don't have to go to a spreadsheet and do some calculations on it. I can come to the Reports tab. See if I show that here. So right here, this is basically what I'm talking about in application setup. So this defines applications for audits. And basically narrow that down and only show this person things related to that application. So the inbox, the documents, the archive, and the reporting. So next on the report tab, we're going to the reports specific to this area. One, we're seeing a stacked bar that shows the marks, a section, each unit. So 3 has a lot of negative marks. Visually, you can see this quickly. And that's the great thing about data and pulling it into a visual report. You can quickly understand what's going on. You want to look a little closer, you can see that these stories is a part of that form. On the form, they have questions about introductory documentation, a few questions about assessment, so it's basically split up into 6 parts. So then this report will show us those 6 parts and each of those areas is. So it looks like each of these has a lot of do with the assessment. And visually, I can quickly see that. I also have the data down here. If I look at the data, I can do that. The thing I can do with reports, I talked about putting them on a schedule and sending them to other people. I can also export that from right here to a PDF, to a spreadsheet, to a Word document, to an image, so that I can put it into, maybe I'm a department head, or maybe I'm the process owner here. I have a lot of other related process. I'm going to just put that in to part of my report or part of my PowerPoint presentation. Easily get it out of here with our reporting tool. Another example of one of the reports is the averages by unit. So this gives me over time how records have been. So I'm basing this chart off of 9 records for these 2 organizations and 15 records for this one, and it's giving me an average. So the average total is 90 and 89. The positives, the average negatives, and the number of records. So that's displayed here as well. So we see right away how in each of these departments. Of course, there's going to be better processes, better outcomes. The benefits of a solution like this is you're going to have that real-time reporting. You can see what's going on. You can narrow down to date ranges. You can get trends. You can understand what's going on in your organization. Paperless solution. So prior to having this electronic, we were filling out a paper form to some department. That person in the quality department keyed every one of those 60 answers into a spreadsheet for every form. So 5 unit, and I showed 6 units there. So that's a lot of paper documents that they're through each, to get this into just a spreadsheet. So we're doing all of that time that it took for that one person to do that, and pushing that work back to the original of the document. And key it into the electronic form. It's going directly to a database. Also doing calculations on that form that would have been done maybe in the spreadsheet, so you can get these compliance and other measures easily without having to copy it into your spreadsheet. Eliminate the errors. So if you're talking about any process that involves taking the paper document and then describing that to an electronic format, there is a high potential for bad translation, missing something on the form. It happens all the time. So eliminate errors in these processes as well. As I talked about the approvals, while we're going through, I'm on the form as the person who is doing the review, and then the department head is also signing off that they've seen this review. So it gives you enforcement of the process, and it gives you accountability. So those people had to have reviewed this document. They had to have been involved in this process. They signed off on the process, so they must be aware of their compliance rates. So it enforces that certain fields be filled out and completed. You can't submit a form that doesn't have all the data that we're asking for in this case. Another example of what a dashboard and an application view looks like is the coding query. And we've talked about this before if you've been on these educational seminars. But the query is basically a part of a revenue cycle where the medical record goes to coding. Coding takes what's in the record and codes ICD-9 codes, sends it over to billing for billing. Exception in the process occurs when the coders look at the record and they can't quite make the decision on what to code it as. So that's going to delay billing. If in a paper process, and especially across a distributed organization, that's very costly for you. So do that in an electronic format where it's happening in real time. When a has a question, is instantly presented into the physician's inbox where they can the question force them to their inbox. We can give them the notification that they have things to go to work to, but the transmission of data, the transmission of the task happens instantly, and the transmission of the data back to the coder happens instantly once the physician fills it out. This gives us a dashboard that shows open and outstanding, whether or not we have any delays in our system. So we have a much fuller dashboard. So some of the coding that we can do when we create a dashboard. It's showing me that I've got quite a few open queries in various stages of completion, and I see where they're at. I can see when they were last acted on, but we'll set up behind the scenes that say, days old, we need to trigger some color coding so that this process owner doesn't have to spend a lot of time finding things that they need to worry about, but they can see right here, if it's greater than 15, it's going to highlight as yellow. That's a problem. More than 2 weeks old, delaying the billing cycle, that's a problem. In red, if it's over 30. So if this number is greater than 30 days old, it's going to highlight as red. That's a bigger problem. So you get this dashboard that lets you know what's going on out there, lets you know that process. Also, there's a drop down here, so they can have multiple dashboards related to the code and query process. This board shows me what's going on as far as the process and the people and the forms involved. This shows the physicians along with, and it shows me a list of documents across the top. So each of these documents is pertaining to a particular treatment class, and so I see right away if physicians that are submitting a lot of these, you can see anything that has a number greater than 0 is going to highlight. So I can quickly look across this and see if there are a lot of submissions under acute blood loss anemia, or I can look across this and see if Dr. Fine is generally issues with the coding. So this gives me just a quick heads up about what's happening, and we'll get into the other reports that we can do on this as well. So the reporting view, I can click on that for reporting and see the coder query form usage per doctor. So that shows me what doctors are using forms for particular treatment classes. This report shows coding query types, so the number of coding queries by the procedure type. So I can see, is there any particular procedure that we probably need to either do training on or more documentation around? And then the report that I have on this list is coding query by the coder. So I can see what are submitting most of these requests. Some training on that side of it. It just to identify your trends, because what this is it's a deviation from the process would be straight through from decoder to billing. If that process is deviating, it's a time issue. It's causing you a delay. So we want to eliminate that. This helps you find where those bottlenecks are, where the delays are coming from. It gives you the ability to measure once you do add documentation to these procedures or do talk to these employees about their processes. Once you're taking those steps, then you can measure and see if those are having an effect. The report for coding query type, and you can see right away, ammonia is the biggest piece of that pie. And again, visual reporting is so powerful to get information quickly. And of course, the background to that. The next of the presentation is about content management. So all of these electronic forms, they're flowing across the organization. They're full of information. They're full of data. We're keeping in different formats for you. Next step, of course, is going to be managing that content for the long term. Where do we archive that? This isn't always medical record information, so it doesn't go into the EMR sometimes. So there are things like net reports. There are things like accounts payable, purchase requests, all types being created that's not clinical, and everybody understands the EMR and the value the EMR presents. So taking the value set to the business office and running as a more efficient business is a valuable tool. So content management gives you the ability to basically create an electronic filing cabinet for what we're talking about, whether it's HR in this example, accounts payable, risk management, purchasing, any type of paper-heavy organization can transition to electronic filing cabinet as part of space that you're using for paper storage, eliminating the needs for transitioning paper from site to off-site storage locations, and lowering the cost of retrieval. Being able to meet your compliance needs by storing your incident reports, risk management documents electronically, so that you can quickly show that you're reporting these, that you can put years worth of reports of these forms processed through our system. You can also scan documents into this, and so not just the Formfast documents that go into a content management system, it's all the documents. It's the put on a scanner and index into the system. So all becomes searchable, it becomes shareable. You can get it out of the system easily. Simplify for your users who are knowledge workers, who are really required to do a lot of, look something in the file cabinet and give us information back. And in a paper process, if you have that online electronically and it's a quick search to build up a set of documents for, around a certain subject, that's going to eliminate a lot of wasted time pulling documents from a physical storage unit. A content system is going to reduce mistakes by putting information at the fingertips of your users. Again, information there and available is going to help them do their job rather than relying on their memory or to go look things up. Being able to do just a couple clicks to get to the actual content, to have that reference space available, is going to be valuable for your users. And again, that storage space or eliminating the cost of moving documents off-site is going to be a benefit too. You can use space for other things. Tool that we talked about portfolio is the output management. So I talked a little bit about the work of output management, basically being able to take a print or an HL7 message that comes in when you register a patient or when you work in your department, taking that information and generating the documents that are needed. So generating the packet, generating REMS, generating consent forms, all that stuff can happen without having your staff actually go to a load of pre-printed form and print it. So we're going to take information that comes to us from other applications and determine what that is, and then what we do with that information. Do we print documents? Do we send an email or send it to a fax handler? Those decisions are the workflow behind that. When you're a patient, we get that print stream or that HL7 message. We understand whether the Medicare patient, whether that's a patient 18 who needs a parental consent form, what unit they're admitted to, those types of things. And we use that to make the decisions to generate the packet of documents that's created. We're relying on a person to make those decisions or to have that knowledge, and it eliminates that potential for human error, for things to be missed. We had one customer who found that for every time a certain procedure were performed, they were one part of it, and it was $4,000 error. So they're getting reimbursed $4,000 every time they did this procedure, and they missed this one thing. So modifying the business rules behind the scenes, and they identified a trigger that would trigger the create a new document that basically forced documentation of this procedure, so that they would have a patient for insurance, so that they could put that into the claim and recoup that $4,000 going forward every time. That's a big difference. Are going to eliminate your errors and omissions. Eliminate the inventory of pre-printed forms. You don't need to keep pre-printed forms. Everything comes out of a laser printer. We put the demographics onto the form. We templates. Eliminate the obsolescence of forms, because once you publish a form into Formfast, the new version is the only version available. That means that you have accurate and legible forms and documents. So rather than relying on embossing or stamping or labeling or handwriting, it comes out of the laser printer and it's personalized to the extent that we can pull out of the database that you have and put it onto that document. So we can really personalize these documents for your patients or for what the subject is. And of course, you enhance your current system. So as you're working in your registration system, this is an enhancement to that. You're not going to have to move out of that system to another system to do any of this stuff. It's just going to enhance the capabilities of that system and leverage your investments in those systems. So just to show you what I'm talking about as far as what demographics on a typical form. So information from the database will borrow two things on here. One is a patient identifier, and the other is a document identifier. What this is the ability to now take this form and take a stack of unrelated forms that are coded. It goes onto a high-speed scanner into your EMR system, and because they have these two barcodes on there, and that EMR system is going to recognize this for what it is and put it into the right medical record and place it as the right document type. So this is the registration clerk registers the patient, clicks print. Once that Formfast intercepts that print stream and applies the logic, and then we generate the documents and distribute it to print, fax, email, or whatever the distribution is. Of course, we're talking about the registration area too, is electronic signature. For the registration area, it's for the ED. You also receive probably a bulk of your patients. It's also for bedside electronic signature capture. So eliminate the need to print the consent forms. You can always print a copy of the signed form once it's done, and it's going to prevent the delays. If a patient doesn't have certain documentation in the record after they've been admitted and they can't find that documentation, maybe it's waiting for scanning, maybe it's going to be scanned at a point in time when somebody gets to it, that could cause a delay. So this happens immediately. Once that paper is signed, it's to the EMR, and then it's there available for the next person to know that it's there and they can continue with the process. Again, an entirely paperless process is going to reduce your needs for physical storage. You won't need to print, you won't need to store that physically directly to an archiving system or EMR. And with the barcodes, you can directly index that into your archive. I just saw a question come in, controlling the size of the barcodes. We have a form design software that gives you to basically your paper form, scan that in, and it does an OCR across the whole form. You get not a picture of your form, you get an actual document that you can work with completely. Apply data to that form from a sample of your print stream onto that form and into that form. So that's what I'm getting to, is that the is done in a design tool. It basically defines code as a and the size of that element. Do calculations based on data that comes in, so that we have, to have a combined barcode or anything like that. So we can do a lot of things to generate the barcode and to control the display of the barcode. So a data mapping and design tool for that. I just saw that question come in. So to the signature. Then one design tool that I was talking about. That's why that segment was kind of relevant. We have one design tool that allows you to take your forms to our system, a document that you can work with. You can do spell check, you can do reading the entire document, reformatting. Now you have this what was a paper document as an electronic asset. You can control the design. You can standardize the design with templating. You can standardize the data that goes onto that with templating. Modify a lot of forms at one time, and then leverage that with a lot of different platforms. That same tool that you used to do that helps the forms that you use in our workflow, on workflow product, in our automation product, in our electronic signature product. So across the board, there's one tool that's very easy to use that lets you do all of this for all of the products. So once you've created the document, you can use that in with one type of signature device. You can put it in your registration area with another type of signature device. Same form, multiple applications. So you have one basis for all these documents, eliminate rework. The products that we support, the model with electronic digital signatures, along with a signature pad for the patients to sign. ClipGem, which is a digitizing clipboard, to print a copy of the entire form, and then the patient can fill out that form, sign it, and then walk away with their copy while you read the electronic original. Mobile devices, tablets, Android and iPad solutions for signature as well. Just these wedge devices, capture devices as well. So we have a wide variety because the hospitals that we work with, them will use multiple devices depending on the situation, depending on the environment. Then of another process, the tools to get you there is forms on demand. So we've talked about getting forms and into electronic assets. And let's talk about distributing those to your end users so that they can have the latest version of the form at their fingertips, show the documents that they need in their contextual area. So if they're in a treatment or therapy area or in lab, we would only show them the documents that they need to see. Give them a patient list so that they can select a patient, select a packet of documents, and generate a personalized packet for that patient, or select multiple patients and packet and generate a full set of personalized documentation for a group of patients. It's a very simple interface to be able to do this. It's intuitive. You have a list that's filtered to the user for what they need to see. They would select what patient they want to generate a packet of information for, and they would select a packet of information they want generated and hit print. It's very, very simple, very powerful. So the examples is at the end of shift, refreshing a folder, group of patients. You just click on one button to all your patients on that floor or on that location. The packet you want, click print, and now you've just refreshed. You've created a set of documents for every patient that you're responsible for. Very time-saving method to that. So I have a few questions that have come in, and a lot of what we have, about 10 minutes left. So at this point, I'm going to stop for questions. If we have any questions.
Thanks, Sean. Yeah, one that we had that came in is, how is the data collected? And I think this is in reference to when you were talking about the dashboards and reports.
Yeah, the dashboards and reporting part of it. Look at this form right here. And what is, each of these registers is a fillable field, and these blanks are as well, the blue box. So they've required some fields to be filled. They're not required to be filled. Is collect all of the data for every one of these fields. So this goes through processes. One fills it out, then the next person fills it out, then the next person fills it out. Each of these pieces of data is being collected by Formfast, and that then makes it available to do your reporting. We're collecting information, and we're to pull that up, sort it out by different segments, and display it. I hope that's a question.
Are the dashboards customizable?
It takes some training. Right now, we're doing a lot of it as a service offering because they know about it, we're on it, but we have an interface to customize them. But work with our customers so that we both get a better feel for what the product can do.
And we're waiting for other questions to come in, and some of the comments that were coming in via chat. Some of our attendees mentioned different processes that they wish were automated, and some of those that came in seem to be common processes that we hear from our customers on a regular basis. So not to put you on the spot, Sean, but I wondered if you could speak a little bit about incident reporting and medication reports and how we can help automate that.
reporting, we do have documents, the AHRQ standard inside documents. We have, using our design tools, turned into electronic assets and that we can collect information on. So basically, number one, we took those forms, which were very long, and went into short forms by using drop lists and check boxes. One way to speed up the process, but of course we're putting that in fast flow, which gives us the ability to get all this reporting and dashboards and application views built on top of it as well. So we have the incident report would be a report that is on your intranet for any organization to submit. They would be able to fill that out quickly, submit. Whoever processes that would receive that report. It would have a number associated with it, and then a lot of paperwork that goes on behind the scenes related to that. So being able to relate those all together through a set of documents and forms and online workflows. So we have some reports built out for that already. We also have standardization with the AHRQ standard data format. So as that information is flowing into FastFlow, it's being put into FastFlow in the standard data format, so that output and sent in the XML format to a PSO if you're cooperating with PSO, or if you're a member of the PSOs, or if it can be determined that it is the system of record for patient safety, then it can be saved and protected as well. So there's a lot going on in that area, and if you want to reach us, we can talk specifically about that as well with a demo and a needs assessment.
Great.
What was the other one, Aaron?
Another one that we hear a lot about that there were some comments about was the forms approval, the forms committee automation.
A workflow that basically has a approval process. So designers are building out the forms, or he is requesting a form. He can submit a form to a group, a committee, that asks for permission for the form to be created, modified, and then follows that request through its life cycle, whether it was determined or whether it was determined to be needed. It follows it through a process. It does things like grouping, so that it goes to a group of people to review. It does things like routes to the people who are involved with that document. So if it's a clinical document, maybe it needs to go to nursing and medical and maybe device people. So you can dynamically route that through your organization to the people who are involved with that form that's being requested or changed for the approvals. As well, a process that has basically a request and approval, or a group approval type process, and it's driven by a form, or maybe it's just loose driven right now. You can develop a form and build that out in our FastFlow product.
Thanks for taking the time to go into more detail. I know that a lot of our customers have similar needs with those particular processes, so appreciate that. Final question. Scott wants to know, what is the DBMS on the back end?
Solutions are built on Microsoft technology, so Microsoft SQL Server.
And it looks like that is all the questions we have at this time. Thanks as always to Sean Curtis for taking the time to join us.
All right. I want to thank everybody for taking time out of their day to join us, and hope to see you next time.
As I mentioned, we're committed to providing solutions to critical challenges in the hospital. So if there is a process that you feel like should be automated, feel free to reach out to me personally. My email is avox at formfast.com. Once again, A, V as in Victor, A-G-H-T at Formfast. For future webinar topics, send them to me as well. This focused on some of the you can improve processes in your hospital right now. Next month, we'll be looking at the big picture and exploring the automated hospital of the future in a presentation we're calling the High Performance Hospital. We'll be joined by former Director of IT at Doctors Hospital at Renaissance and noted author Scott Fuller, so make sure that you tune in for that. You can register for this webinar by visiting formfast.com/webinars. You'll also find a link at the conclusion of this session, a way to set up a personal consultation with a Formfast workflow specialist. So take a minute for the next webinar, and I encourage you to reach out to us to learn more about workflow automation. Thanks for joining us today, and we'll see you next Formfast webinar in August.